Hi everyone, welcome to Crown Pointers. Heart disease is the leading cause of death in the United States, and most of us spend a lot of time dreading the cancer word, but actually the prevalence of heart disease is much, much higher. Today, you're going to learn how to spot a heart attack so that you can get treatment as quickly as possible and improve your outcomes. Dr. Boyd, what are the signs of a heart attack?
Classic signs are chest pain, and that could be of various qualities. But generally, it's not a stabbing pain. It's kind of a dull, achy, kind of hard to localize pain. It can spread up into the neck or into either arm, most commonly the left arm. But often there's difficulty breathing, and you don't feel good. You feel nauseous and sweaty. Sometimes dizzy. You just don't feel right. Mm-hmm. But those are your classic signs. Men seem to get those classic signs a lot more than women. So if you're a woman out there, please pay attention to the more subtle signs, the dizziness, the nausea, the vomiting, mm-hmm. The kind of iffiness. What tends to be the best indicator of a heart attack type of pain is it's not going to stay the same whether you wake up, go to sleep, whatever. Generally, it tends to be worse when you're active. That doesn't mean it automatically goes away when you're not. But if someone is having this pain, but it's only when they're moving their upper body and they're sitting down, that's not likely chest pain. If they are up, busy, doing something, they get this pain, they sit down, it goes away, pain in their arm goes away, the other symptoms go away. But then they get back up again and they're going to go for a jog and they get that same pain mm-hmm. again. That's a sign that an artery in the heart is really struggling. The muscle of the heart isn't able to keep up with that demand. And so that's more frightening. That's more indicative of a heart attack.
How long should someone wait if they're experiencing ambiguous symptoms and wondering, how many times should they try exercising and then sitting down before they take action?
That's a loaded question. One, have they had this pain before? If they have, and they tend to know what type of pain it is, do not pass go. They generally have nitroglycerin at home. They're told how to take it. And if it's not resolving, they get themselves to the hospital immediately. Mm-hmm. Others, we'll talk about risk factors. If you're at high risk, I would recommend a shorter window of time and a shorter fuse as to when to pull the trigger. If you are a young, healthy, active person and have never had any signs, if it tends to recur with activity, I would have a very short index of suspicion. If it goes away and doesn't come back after a few minutes, I don't think I would worry. But again, if it's more than one of those symptoms combined, more need to worry.
And I'm guessing err on the side of caution whenever there's any doubt with the
I
heart.
would. And honestly, I have been in the room with somebody who I suspected having a heart attack, and I've had them pop an aspirin. I waited a few minutes. We did end up going to the hospital shortly thereafter because they were higher risk. But do err on the side of caution. Do not play with it. Mm-hmm. Heart is muscle. Time is muscle. It's very important.
What are the risk factors that someone should be aware of that put them at a higher risk?
The risk factors are ones we all tend to know about, but none of us do a lot about. So there's certain ones that we can't do anything about. Cardiac history in your family. So men under 55, women under 65 who have had a cardiac event, those are risk factors to you. Mm-hmm. So your mom, but it tends to be a first degree relative. So your mom, your dad, your siblings, mm-hmm. okay? Your genetic makeup, you really can't change. Men tend to be more common than women, and men tend to be earlier than women. So age and sex, you can't change. Those are the non-changeable ones. Mm-hmm. But the better thing is we have control over the majority of them. So weight and inactivity. Get yourself up and moving. And I don't care if it's 10 minutes a day to start, just do something. The ideal is 30 minutes of moderate activity most days. And I don't care what your activity is, the activity you should do is the one you will do. Mm-hmm. So if it's gardening, golfing, fine. Just keep yourself active. And yes, it would help if you increase the intensity, but do whatever activity you will do, but stay active. It is the fountain of youth as far as I'm concerned. Keep your weight down. That does not mean watch every single morsel and never eat another piece of birthday cake. It just means in moderation, because small losses or gains in weight make a very dramatic difference in your risk for heart disease and stroke and all kinds of cardiovascular event. Cholesterol, try to keep it under control. There are reasons that we care about these things. Diabetes and smoking. So if diabetes, smoking, high blood pressure, cholesterol, weight, and inactivity. Those are the ones you all have control over.
And if somebody thinks that they are having a heart attack or someone that they're with is having a heart attack, drive yourself to the hospital?
No. Rare instances would I ever say that if you're out in the middle of nowhere. But if you have one, a regular strength aspirin, not one that's enteric coated, meaning not one that slowly dissolves in your stomach over time. That's what enteric coated means. One that's a regular, it tastes gross, but chew that aspirin, get it down. It's not a bad idea to note the time, but call 911, call 911. And if there's any question about the aspirin, you just call 911 first.
Okay. Thank you, Ann.
You're welcome.
Well, we hope everyone stays really healthy and that this tip is helpful for you. When in doubt, please call 911. But we are hoping you very long, healthy, happy life.
Take care of yourself and take care of those around you.
Thanks, everybody.